Welcome to SimX. In this tutorial, let's familiarize the learner with the virtual environment. Once you open the SimX app, you will find yourself in the hospital lobby. Press the left menu button, also known as the hamburger button. This will pull up the SimX main menu. On the right side of the menu, click on Search Sim Group. From here, locate your instructor's sim group. Once you have joined a group, hang out in the hospital lobby until your instructor launches a case. Now that you have entered into the simulation, take a second to look around and take in your surroundings. Once you enter the case, feel free to walk around just like you would in real life. However, make sure not to lean against objects in the virtual environment, such as patient beds or tables, as those objects only exist virtually and not in the physical world. To open and close your hands, use the trigger buttons on either controller with your index finger. To make pointer fingers, use the A or X button on either controller with your thumbs. To pick up tools and instruments, simply place your hand on the object and press and hold the trigger button. The object will then appear in your hand. If you let go of the trigger button, the object will return to its original location. Note that in most simulations, you can remove the patient's gown and bedding to better evaluate your patient. Notice the blue highlighted areas on the patients, tools, and throughout the environment. These are known as colliders and indicate areas you can interact with. Simply put your hand in the collider, or if holding a tool or instrument, tap the tool or instrument to the collider and you will either hear, see, or feel a reaction. When evaluating patients, note that in some instances, interacting with the collider may not elicit a reaction and be part of the patient's diagnosis. To put your patient on vitals, locate the blood pressure cuff, cardiac leads, and pulse oximeter. In most cases, these are located near the head of the patient's bed. Using what we learned earlier, grab each item and place it on your patient. Patient vitals will then appear on the monitor in the room. However, keep an eye on the patient vitals. Just like in real life, at times, these can fall off. You will have an electronic medical record or EMR tablet. Here you can look at exam results, read patient history and active orders, or put in orders yourself, and much more. Pick up the tablet with either hand and hold it so that you can read it. Press and hold the A or X button with your other hand to make a pointer finger. To make a selection, tap and hold. You may also use your finger to swipe through the information. Most hospital-based cases will have a Pyxis machine located in the room where you can access medications. Depending on the case, you may need to call the doctor and have them put in the order, or, using the EMR tablet, put the order in yourself before the medications will appear. Select the medication that you would like from the screen. The medication will then be dispensed. If it requires being drawn up, grab the medication vial in one hand and the syringe in the other. Insert the syringe into the vial. Using your thumb, pull back on the joystick to draw the medication. To administer the medication, push the joystick forward. In most cases, there is someone there to give you a handoff report. Depending on the nature of the case, this could be another nurse, doctor, EMT, paramedic, or family member.
Hi, are you ready for handoff?
Yeah, that'd be great.
This is Cynthia Bennett. She's a 34-year-old female with a history of type 1 diabetes and end-stage.
Feel free to talk and interact with these individuals. There may be times when they don't give you much information, and it's up to you to use available tools and resources to learn about and care for your patient. To speak with your patient, simply talk to them like you would in real life.
Hi, Cynthia. My name's Lauren. I'm going to be your nurse today. How are you feeling?
I'm doing okay, I guess.
You're just doing okay? All right, well, let's check you out.
There may be other family members and
sir,
friends
must
in
be
the
with
room that you
Cynthia?
can speak to
Yes.
as well.
I'm Cynthia's husband.
Wonderful. Nice to meet ya.
How is Cynthia doing?
Well, I think that's why we're here to get her checked out. Cynthia, how are you feeling?
Thanks for watching, and we hope this tutorial has been helpful.